Hi, everybody. I'm Dr. Kate McLean. I'm a board certified OBGYN, and I'm the Chief Medical Officer here at Evvy. We get a lot of questions about how we work with providers to treat patients after they've tested with Evvy. So let's dive right in. We have some providers who prefer to do all of their own prescribing. So let's say they have a patient who's diagnosed with BV on the Evvy testing platform. That provider then wants to order the antibiotic, maybe any probiotics that are necessary for treatment. We also work with providers who are not prescribing providers, maybe pelvic floor physical therapists, nutritionists, and they prefer Evvy to handle all of the prescribing, in which case we're completely happy to do that. And then we work with providers who prefer a hybrid model. So Evvy does cash pay for patient treatment. So we have some providers who say, well, I would rather prescribe the antibiotic myself so the patient can get insurance coverage for that. But I don't work with a compounding pharmacy and I want the patient to get a probiotic. So I would like you to handle that portion of it. And patients have an opportunity to choose a la carte which treatments they would like to get from Evvy, and then work with their own providers to cover the rest. So the answer is we handle the full spectrum and we just want to do whatever is going to work best for you and your patient. We also get questions about how we approach treatment overall. So let's take an example. Let's say that somebody is diagnosed again with BV on the Evvy platform. What treatments might we recommend? How might that look? Well, the first is we want patients to have symptom relief as quickly as possible. And so, although pure symptom relief products are not, for some reason, part of the standard of care for something like BV or yeast infection, if somebody is having itching, for example, we're going to prescribe them an anti-itch cream just to get that relief as fast as we can. And then next, especially when it comes to BV, we're going to be looking at their test results to see if there are any microbes that are known to be biofilm producers. So the Gardnerellas, the Prevatellas, those big players in the BV space are known to produce something called biofilm, which is this sticky net of bacteria that makes it more difficult for antibiotics to be effective. And so if a patient is known to not be pregnant, then we might suggest a week's worth of boric acid prior to an antibiotic treatment. So boric acid vaginal suppositories are not safe during pregnancy, so that's something to keep in mind. They're also dangerous if they're ingested orally, another thing to keep in mind. But for the right patient, especially those who've had recurrent BV, something important to think about. Next, of course, we're going to be thinking about antimicrobials. And we take a number of things into account with that. First is we ask the patient a lot of detailed questions about previous treatments and how they tolerated those treatments and what their allergies and preferences are. And we take that all into account when we're choosing an antibiotic. We also choose vaginal antibiotics whenever we possibly can, just so we're not disrupting the patient's gut microbiome or causing them any nausea or other GI symptoms when we don't necessarily have to. So for BV, we're oftentimes choosing between prescribing vaginal metronidazole or vaginal clindamycin. And both of those treatments we know work really well and are really well tolerated. And so the decision between them can come down to what the patient's results show. So certain things to keep in mind. We know that clindamycin can damage lactobacillus populations that are protective in the vagina. So let's say that somebody has, 50% Gardnerella, but 50% lactobacillus, and you don't want to kill off that lactobacillus population. You might choose metronidazole since it doesn't damage the lactobacillus. Whereas if somebody's like 99% BV microbes, you don't really have to worry about that as much. Then, of course, we take a really directed approach to rebuilding healthy lactobacillus populations in the vagina after antimicrobial treatment. We typically are recommending a vaginal probiotic, which we do at our compounding pharmacy, that contains things like Lactobacillus crispatus for an acute period of time to really try to rebuild those populations as quickly as we can. And then long-term maintenance, oftentimes we're suggesting an oral probiotic with strains that are targeted to vaginal health, like Lactobacillus crispatus, rhamnosus, reuteri, those big players. So that's generally how we think about treatment.